The quest to build a community-led and needs-driven genomics and bioinformatics cloud infrastructure for Africa conveys data scientists in Banjul under the aegis of the Medical Research Council. This training on cloud computing is a unique platform converging stakeholders across West Africa to advance tools for informatic data-driven operations in public health responses. The initiative seeks to enhance sustainable digital infrastructure for pathogen genomics in Africa for the next 10 years. Abdul Karim Sise, the head of Genomics Strategic Platform at the MRC unit, enunciated the importance of data-driven pathogen detection for effective public health services.
So having an infrastructure to be able to really address any outbreak and be prepared for any pandemic is really an important aspect. And for that, because we're talking about digital information, having a facility for being able to analyze digital data is really very, very important. And in bringing people from the West or the North, we don't have to reinvent the wheel. We have to learn from what works really well and how we can use it in our own context. And having this meeting in the Gambia, having it at the MRC, and in collaboration and working with the Minister of Health, and also having even representative for the Minister of Education, is really important to look at what digital will look like in the next 10 years.
To better manage and utilize sustainable pathogen genomics and bioinformatics for Africa to aid operations during virus outbreaks, a world-renowned international microbial bioinformatic dedicated to support health services facing big data challenges in modern microbiology is taking the lead in the Cloud Computing Forum. Tom Connon, the public health professor from Wales, highlighted the essence of digital data in microbial sequencing.
There's a lot of cases where we're starting to see alignments between human genomics and pathogen genomics. So where you have particular pathogens, where if you've got particular mutations in your genome, you have an increased probability either of developing infection or of having a more severe outcome. And so increasingly, I think what we're going to see is movement towards understanding human and pathogen genomics together and using that as part of treatment development and using that as part of control mechanisms, and that's going to be really, really important.
Peter van Husden, a South African researcher from the National Bioinformatics Institute at the University of Western Cape, emphasized the need for urgent interventions to build strong data system in health institutions across Africa.
But this is all very theoretical. We need computing, we need computing, we need computing, and then 31st of December 2019, we go on Twitter, as one did back in those days, you know, to see the infectious outbreak news. I'd been following what I called emerging infectious disease Twitter. They're kind of people that would always be interested in, like, oh, there's a new outbreak here, or whatever it is. And there was a notice, there's something in Wuhan, okay? And suddenly everything shifted. So we saw the massive deployment of sequencing machines in public health institutes.
The Cloud Computing Forum is a significant milestone earmarked to lead a new era for pathogen genomics and bioinformatics research advancement in Africa. Omar Faye, GRTS.